there. In last week's episode, I shared my journey with hormone replacement therapy and why I use it. If you haven't listened or watched that one, I highly recommend you go back and do so. Today, I want to dive a little bit deeper into hormone replacement therapy because there is a lot of controversy around it. As you've learned by now, hormones start declining in your mid-30s, starting with progesterone, often along with DHEA. Testosterone also starts to decline, although for some women, they may get a surge, but then it's typically followed by a decline. And at some point, estrogen starts to fluctuate wildly before it also starts to decline about 1 to 2 years prior to menopause, which is when you've essentially stopped getting a period for about 12 consecutive months. Because of the decline in these hormones, women not only begin to experience bothersome symptoms, but they have an increased risk of developing chronic diseases such as heart disease, which is the number one killer of women in the US, by the way. Obesity is another one, different types of dementia like Alzheimer's, as well as osteoporosis and even different types of cancers. You know, women are living longer. So if you're starting perimenopause in your late 30s to 40s, that is a lot of time left on this planet in a low hormone state. Hormones are the most potent biochemical molecules that you have. Think of them as chemical messengers, if you will, that carry vital communication between your glands, your organs, and other hormones throughout your body. So when your hormones are not communicating properly or when they are out of balance, you will experience symptoms and your health will suffer. So there comes a point in your life when it is advisable to replace what is lost in order to not only feel and look your best, but for improving your long-term health. So this is what we call hormone replacement therapy. So you will likely hear me use the term HRT, hormone replacement therapy, or BHRT, which is bioidentical hormone replacement therapy, interchangeably. Now, some practitioners refer to it as bio or body identical hormone therapy, and you may also hear the term MHT or menopause hormone therapy. I actually find that one to be a little misleading because it may make women think that they have to wait until they're in menopause to start hormone replacement, and that is not true. I actually talked about that in last week's episode. So when I say HRT or BHRT, please know that I'm referring to bioidentical hormones, which have the exact molecular structure of the hormones that are produced in your body. They are plant-based. They are made from hormones found in plants. Bioidentical estrogen comes from soybeans, and bioidentical progesterone comes from the tubers of wild yams. So testosterone can come from soy or yams, but we will not get the same benefits from just eating soy or wild yams. Please hear me on that. They must be synthesized in a lab. Certain foods like seeds or herbs, they cannot increase your hormones. They may alleviate some symptoms, but they will not replace hormones. Hormones replace hormones, and that's it. All right. So on the other hand, we have synthetic hormones that are available to us, right? As in hormonal birth control. But please know that they act very differently in the body. They are metabolized differently. They cannot be measured using any type of hormone testing, and they come with side effects, right? Or long-term health ramifications. Now, while it is always a woman's choice, I don't recommend using synthetic hormones, particularly in this perimenopausal stage of life. Synthetic hormones increase your risk of disease, such as dementia, heart disease, stroke, breast cancer, and of course, blood clots. And unfortunately, many conventional doctors will prescribe synthetic hormones to women in order to minimize their perimenopausal symptoms. And listen, there is a time and place for everything. I would never judge a woman for using synthetic hormones, especially if you have really horrible periods or symptoms that you just you need something to help you. But please know that that is not your only option. Bioidentical hormone replacement therapy could really benefit you. And like most medications, they mask the underlying issue, the synthetic hormones, which is a decline in your endogenous hormones, right? Which is what your body naturally produces. So in my opinion, why not replace those hormones with what is available to us, something that actually mimics the exact molecular structure of the hormones that we already make naturally. All right. Now, please don't let your doctor or anybody tell you that those two are the same. They're not. So progestin and an ethinyl estradiol are not the same as bioidentical progesterone and bioidentical estradiol. Okay. They are are synthetic hormones, again, made from chemicals that do not exactly duplicate the body's natural hormones. Luckily, BHRT or HRT is becoming more mainstream because more and more health experts are out here educating on all the benefits. However, there is a common misconception that HRT is dangerous and even causes cancer. Now, if you use a commercial prescription of estrogen, you may see a lot of warnings in the insert, including box warnings. So box warnings used to be called black box warnings. They are the highest safety-related warnings that the FDA assigns to different medications. Unfortunately, the reason for all the fear around hormone replacement therapy, as well as these warnings, is due to the Women's Health Initiative, which was a heavily flawed study that happened years ago. I want to give you some history on it so that you understand the false information that came from that and unfortunately spread like wildfire. So the NIH, which is the National Institutes of Health, funded the Women's Health Initiative study. And this was the largest hormone replacement therapy clinical trial that included over 160,000 women between the ages of 50 to 79. So the study began in 1993, and it was supposed to run for 15 years across 40 clinical centers nationwide. So the goal of the study was to figure out how to deal with the most common causes of disease and death in menopausal women: heart disease, bone loss, and cancer. The groups of women in the study included women with a uterus who were taking Prempro, and that was a very popular HRT. But please note, it was a synthetic conjugated estrogen coupled with synthetic progestin. The other group was women without a uterus taking Premarin. This is also a synthetic estrogen, but that was from the urine of horses. And then the third group was women with and without a uterus taking placebo. However, the study ended prematurely in July of 2002 because interim findings showed an increased risk of stroke, heart attack, and breast cancer with the use of Prempro. So results of the study showed that women who had received it were found to have a 26% increased risk of breast cancer, a 29% increased risk of myocardial infarction, which is a heart attack, or death from cardiovascular disease. It also showed a 200% increased risk of venous thrombotic disease or embolism, deep vein thrombosis, and pulmonary embolism. As well as a 33% decreased risk of hip fracture, a 37% decreased risk of colorectal cancer, and a reduction in menopausal symptoms. So there was no increased risk of breast cancer found in the women taking Premarin. So here's why this was a faulty study. The average age of the women in the study was 62. So the participants had already gone years without having optimal hormone levels, putting them at a higher risk for cancer, heart disease, and other diseases that I've mentioned. The other thing is many of the women had one or more underlying health issues and were already exhibiting signs and symptoms of some of these diseases. And lastly, as if that wasn't enough, bioidentical hormones were not even used in this study. They only use synthetic hormones. And like I shared earlier, they are very different animals. But unfortunately, the news media ran with the story that hormones cause breast cancer, which created so much fear in women as well as healthcare providers ever since. Now, prior to this study, there was about 18 million women, American women, who were using HRT. But because of this study that came out and all the negative press around it, that number went down to less than 2 million women. It is mind-blowing to me, and honestly, it hurts my heart to think of all the women who suffered unnecessarily because of this. You know, this is why we cannot be reactive when it comes to medicine or health in general. It is not black and white, and in my opinion, fear should never be the driver. Luckily, the WHI study committee retracted their statement about hormones and breast cancer. In December of 2019, after an 18 to 19 year reanalysis of the study, it was found that women who had been given estrogen replacement therapy had 29% fewer cases of breast cancer, even if they were on estrogen only for a few years. And if they happen to get breast cancer after having been on estrogen for a short period of time, they had a reduced mortality rate by 44%. So essentially, they stated that there is no increased risk of breast cancer, heart attack, or stroke. There was no apologies or anything like that, but at least the truth came out. Though, of course, that wasn't in the news, and many practitioners still fear bioidentical hormones because of the negative publicity that the study originally received. And years later, we are still doing our best to undo the damage, educate women, and share the accurate science to quell some of the fears around hormone replacement therapy. So there's somebody that I love to learn from. His name is Dr. Rosensweet of the Menopause Method. He has been doing this work for 30 something years. He was in the trenches and lived through all of this mayhem, if you will. And he was one of the doctors who really questioned the study. He continued to give women HRT. And he says, we're all at risk for diseases, and there's many different reasons for disease. But women who are given hormones are at less risk for breast cancer, heart attack, and stroke than women who do not receive hormonal treatment in menopause. And women who have had breast cancer do have an increased risk of recurrence. However, those who are treated properly and given hormones are at less risk of recurrence than women who are not given hormones. So if you need more convincing, a really great book to check out is Estrogen Matters. And this was written by Dr. Avram Looming and Carol Tavris. They debunk many of the myths around HRT and breast cancer. They talk about the benefits of HRT, and they have tons of sources to back up their claims. All right, now that we got that out of the way, I want to talk about some of the benefits that bioidentical hormone replacement therapy provides. So you're going to get protection against cognitive decline and Alzheimer's disease, heart disease, osteoporosis, as well as osteopenia. It supports more restful, deeper sleep, which I can absolutely attest to. It has been shown to improve vaginal dryness, pain, and urinary incontinence. It protects against autoimmune diseases, supports reduction of blood sugar issues, which is prevalent in our perimenopausal years as we're losing that estrogen. It eliminates hot flashes, night sweats, and even improves libido. Now, there are many other benefits, of course. And despite what you may have been told, bioidentical hormone replacement therapy is safe for most women. However, you may be wondering, are there any circumstances or contraindications for HRT? And yes, there are some. So let me just go over some of that with you. So number one, if you have active breast cancer, then you would not be a candidate for HRT. However, after breast cancer, you could be a candidate. And just so you know, family history of breast cancer is not a contraindication. If your mom or a grandmother or somebody in your family had breast cancer, but you did not, you do not need to fear HRT. Okay, I highly recommend that you check out Dr. Corinne Menn, M-E-N-N. I will link to her Instagram account. She has a website, of course, but she shares so much great information on her Instagram account. If you hang out there often, I will link to that in the show notes. She is a breast cancer survivor and talks about this topic all the time. The other contraindication is if you had a recent heart attack or stroke or a recent blood clot. Now, again, after 6 months or so of a stroke or clot, you could also be a candidate for HRT. So please, please, please discuss your risks versus benefits with a hormone literate provider. Now, another contraindication is if you have unexplained vaginal bleeding. You will absolutely want to get that checked out. And then lastly, if you have severe liver disease. Okay, so those are the top contraindications for HRT. Other than that, you're most likely a candidate. So you definitely want to get a hormone literate provider to have the conversation with. All right, so the other thing I want to talk about is over-the-counter hormones versus prescription. So you may have seen a lot of over-the-counter products out there like progesterone cream or estriol or even estradiol. Now, they may help alleviate some of your symptoms, but they typically won't offer the same health protective benefits as prescription hormones because they're typically quite low dose. Now, there are some exceptions. There's some companies like Ona's Natural, I believe believe it's called, and Dr. Platt Wellness, who sell like something like a progesterone cream at a higher dose, around 50 milligrams. Now, that's still a pretty low dose. And hormones need to be at optimal levels in order to reduce your risk of diseases, not just for symptom management. Regardless, I do believe that it's great that there are some options out there if for whatever reason you don't have access to prescription HRT, and you just want some help with managing your perimenopausal symptoms. All right, the other topic that I want to cover is compounded versus FDA approved hormones, because unfortunately, due to more misinformation, these two are often pitted against one another. Many people believe that compounded hormones are not regulated, and that's false. So, compounded medications are made with FDA approved active pharmaceutical ingredients known as APIs. They are from FDA registered and GMP regulated facilities. GMP stands for Good Manufacturing Practices. They all have standards for quality, purity, strength, packaging, etc. for substances and any other ingredients that are used in compounded hormone formulations. Federal and state laws regulate all pharmacies, including compounded or compounding pharmacies. And individual states and the FDA do regular on site inspections with safety checks on compounding pharmacies. All right, so what is the difference between the actual formulations? So, FDA approved hormones contain inactive ingredients or excipients, and they can make up more than 50% of a medication. And unfortunately, the labels don't list the amount of each of those ingredients. And, this can be problematic because many of them will contain allergens such as peanut oil, lactose, different dyes, or even gluten, which can be really problematic for some people. And lastly, many FDA approved medications are manufactured outside of the US where they aren't regulated the same way. Now, the FDA-approved commercially bioidentical hormone therapy options are available at standard chain pharmacies. Many are covered by insurance, and they're pretty easily accessible to most people. So they are a decent option, okay? They're available in a variety of forms, such as tablets, creams, vaginal inserts, patches, gels, things like that. And most of the estrogen options, though, only contain estradiol without estriol, which is another form of estrogen. And they typically only come in a handful of doses. So, for example, the FDA approved bioidentical progesterone is only available at 100 or 200 milligram doses. So, that can make it difficult to fine tune your dose if, say, you need, 150 milligrams of progesterone. Now, on the other hand, compounding pharmacies, they have specialized pharmacists who formulate custom prescriptions without the use of additives, dyes, or chemicals. So you can get a variety of HRT forms such as oral, topical creams, injections, pellets, which I don't really recommend, as well as more formulations, including a combination of estradiol and estriol. That's actually known as Biest. Some providers recommend that over estradiol alone. So I want to leave you with this. Starting HRT is a personal choice, depending again on your comfort level, your needs, your budget, and your preference. When making any decision about your health, it is really important to get educated and weigh the benefits versus the risk with a trusted provider. And lastly, hormone production, hormone communication, and metabolism, which is the breakdown of your hormones, requires nutrients. Okay, a lot of people think they could just go on HRT and that's that. No, you need to be supporting your body as well, right? The nutrients that you need include minerals like magnesium, iodine, zinc, selenium, as well as B vitamins. So many of us are missing essential nutrients due to a nutrient void diet, stress, and gut imbalances. So we may struggle with hormone production, communication, and the detoxification of hormones. This is why we do what we do in the Hormone Rescue Program. We educate you, but we also utilize blood work and functional testing like the HTMA, which is mineral testing, as well as the GI map stool test to assess your nutrient status, address any imbalances, and make sure that your gut is in tip-top shape so you can properly metabolize the hormones, whether or not you are on HRT. So May enrollment for the Hormone Rescue is opening soon. So please go ahead and check out the show notes because there's going to be a link there so you can learn more about that program and how my team and I can support you. All right, I hope that was helpful to you. I will talk to you next week.